Yeah, so hi everyone, my name is Zoe Clark. I'm Self-Management Programme Officer here at NAS, and today I'm joined by Colin Beaver. Colin Beaver is Matron and Senior Clinical Nurse Specialist. Hi Colin, thank you for joining us again.
Thank you. Pleased to see you all again. Hope everyone's all right, keeping well.
Yeah, we hope so. So for anyone who's watched our previous videos, you may have seen Colin did a session all about TENS machines. So we're really pleased that Colin is joining us again, and he's going to be talking all about pain management and describing his pain management toolkit. For the people who haven't seen your video before, Colin, do you want to say a little bit about yourself and where you work?
Okay, yeah, I'm Colin Beaver. I'm matron at Portsmouth Hospital's NHS University Trust with a specialist interest in rheumatic diseases. I'm also an advisor for NAS on the Medical Advisory Board as a nurse representative. And I run a number of programs supporting self-management here in Portsmouth. And we're moving to a virtual way of providing us programs as well at the moment. So this is part of one of the programs I run locally.
Oh, perfect. Well, thank you very much for being with us today. I know you're very, very busy at the moment helping everyone. So we really appreciate it. So for everyone watching, just to reassure you, if you're not able to watch the whole session live, you can catch up on this page afterwards, but also on My AS My Life on our website, and I've put a link in the video description as well. And also we'll be doing a Q&A at the end. So if you have any questions for Colin, all about pain management, please pop them in the comments box and I'll come back on and we'll go through them all at the end. So Colin, I'll let you take it away then if you want to share your slides, and I'll keep it on and they come in.
Oops, can you see my slides?
Yeah, that's perfect.
That's fine. Okay, so thank you everyone for joining me today. And I'm going to take you through some ideas around what you may want to consider to put into a self-management pain toolkit. Now, it's important to remember this is not to replace your regular medication. So for those of you who rely or need painkillers or anti-inflammatories or your other medication, this is not to replace those treatments. This is something that may give you an additional benefit to help get your pain better under control. So what we know about pain is very unique to each individual. It's described as an uncomfortable sensation in the body. It's important to realise that pain will fluctuate over a period of time. Most people have acute episodes of pain. They can also have flare pain, and then also the persistent and ongoing pain day to day. And it's very unique in each individual. And of course, the frequency can change, and also can the severity of the pain can change. We also know that people respond to pain differently. So some of the things that I'll be talking about in the pain toolkit, people may find they find no benefit, others may find they have some benefit, and others will find they will have perhaps a bit more benefit. And we have to recognise that some of that's due to our own level of tolerance for pain. Everyone is unique. If it's localised, it's sometimes more easy to manage, where if it's an all over body pain, can be more difficult, such as fibromyalgia. One of the difficult, challenging things that we all have to face as well is describing pain to a healthcare professional. And what someone may describe as a sharp stabbing pain may not be experienced by someone with the same condition in the same joint. It may be a different sensation. And therefore the treatments and options available may be unique to the type of pain, the severity of the pain, the position of the pain, and also the sensation that the person is experiencing. We also have to recognise that for a majority of you, you may have a persistent low level of pain on a day-to-day basis. Some of that can be improved with some of the things we're going to talk about. As I said, it may just take the edge off the pain to give you a better quality of life. And of course, during your flares, you need to consider what you're going to and how you're going to manage a flare of your ankylosing spondylitis in relation to pain management. So what we know about unmanaged pain, it has a detrimental effect on the individual. we start off our lives in a very happy position and we've been given a diagnosis, and gradually, if pain is not managed well, it can lead to lots of problems. One of the biggest things is we stop exercising or moving, we gain more weight, which causes problems. As the pain accelerates, we end up adding in new medications, which once again causes side effects, maybe gastrointestinal, such as nausea, constipation, which then once again affects quality of life. And also our circle of life can actually diminish. We reduce, I've seen as many friends perhaps, there are relationship problems that are reported in people with persistent pain. And of course, employment, people struggle to keep down a job if they're in persistent pain. Pain management is not just a healthcare professional's responsibility. It is about putting the patient as part of their coordinating team to manage their pain. Of course, if you've got ankylosing spondylitis and you're in the early stages or you are on new treatments, we do need to make sure your disease is well controlled. That may be through regular medication, if you're accelerated through to the biologics, and also topping up with regular painkillers, etc. It's important, and I know the NAS are very keen on ensuring that all patients have access to physiotherapy and hydrotherapy, because this is once again an intervention often provided by a healthcare professional to support patients in managing their fitness, exercise tolerance, and also helping with pain management. But there is a key element that everyone needs to be aware of around what they can do to self-manage their pain better to give improved quality of life. So often we ask you in clinic, how are you managing your pain? And often patients will report that they're doing the same thing every day of the week. So they take their medication as prescribed. If it's a painkiller, maybe 2, 3 or 4 times a day. If it's an anti-inflammatory, once again, once or twice a day. And that pattern of pain management continues from the day you perhaps start the medication. You might change if you have problems with the medication, side effects. But in general, people will report that they take medication on a regular basis to control their pain. I would like to suggest that actually you look at your pain management slightly different. Look at how you manage your pain on a good day versus a day when you're significantly in a lot of pain. You may want to score it 1 to 10, or you may use the happy face to sad face, no pain to worse pain. Of course, if you're in no or little pain, do you need to take the same amount of medication as you've been taking if you're in a bad day? I would suggest it's worthwhile looking at your medication, looking what you're doing. Are you getting out, getting some fresh air, a bit of exercise? If the pain is low, then something like distraction therapy, jigsaws, colouring books, videos, music may be a way to manage the pain. Going to the next level, if it's a specific joint, once again, do you need to take a tablet that gives you an overall pain relief, or could you consider something that's perhaps managing the individual joint, such as a topical anti-inflammatory cream, capsaicin cream? And once again, you may be thinking about things like hot and cold pads and a different form of exercise to keep muscle strength and range of movement going. As you go up the pain ladder, perhaps to the worst pain, this is the point whereby you may be needing to add in additional medication, perhaps topical anti-inflammatory creams, maybe using your TENS machine, but also looking at things like deep breathing exercises if the pain is stopping you doing things that you need to do. Also, if you look at the course of the day, as I said in the previous slide, we tend to take our medication very rigidly, take it at morning, lunchtime, with our evening meals and before we go to bed. And once again, looking at that course of the day, if you were to look at adding in other techniques, you may just find that you do not need to escalate your pain medication too much. So we know the morning stretch and getting the range of movement going in the joints is important. Perhaps if you've got a busy morning and it's certain joints that are causing you pain, or perhaps your back is causing you pain, using a TENS machine. Once again, getting out there at lunchtime, doing a bit of exercise, a bit of fresh air. And then perhaps in the evening, as you're starting to rest and settle down, perhaps using other things such as heat from a hot water bottle, a warm shower or bath may just help So what are your options looking at a pain management toolkit? So we are very used to having toolkits. I can remember as a child, my mother and my grandmother having a sewing toolkit. My father had a garage and a shed which had lots of toolkits and things in it. My mum was very proud of her tidy under the sink kitchen sink, where it had lots of her special things, so doing brasso and things like that. So we are very aware of actually putting things together in one place that actually may be used for a certain function. And I would suggest perhaps developing a tool pain kit may be useful for you. The worst thing you want to do is suddenly be in pain and can't find the items that may be able to offer you relief. And of course, if the pain toolkit is not looked after, you might find that you go to the cupboard and you haven't got the right medication, the right equipment. You may find that your TENS machine, the batteries eroded, corroded and destroyed the machine. If you've run out of painkillers, you may find the local pharmacies shut, or even there are patients, if they're not using certain pain medication on a regular basis, may find that the medication is out of date. So maintaining a toolkit is really important. So when you want to build a pain kit, do you go out and buy it all in one go? I would suggest probably not. It's probably worthwhile over a period of time asking for things that could be for a birthday, perhaps Christmas, and add them to a wish list that may help you build this kit over a period of time. What you store your pain toolkit in may be very varied. You may start off with a small shoebox, and gradually you may build up to a box system whereby you have certain pieces of the pain toolkit in certain colour boxes. So if you had to say to your partner, I'm in quite a lot of pain, you could say, could you get my red box? So in the red box would be everything that you know helps you when you're in a significant amount of pain. When you've tried something, it's worth evaluating it. Did it work? If it didn't work, why perhaps it may have not worked? Was it not you were using it at an extreme pain level and it really only helps at a low level? The reason I also suggest you put it in one area is that actually often we loan things out. So we loan our TENS machines out, or we may loan out our hot water bottle to someone, and then suddenly when we need ourselves, we can't find it. I would suggest this person is quite well organised in their pain tool or in their household pharmacy and self-management toolkit. They've got everything clearly labelled. Perhaps we don't need to go to that level. So we've talked about the TENS machine, and I would definitely suggest if you've not tried a TENS machine or you want to know more about TENS machine, is to look up about it to see where it may give you additional benefit. I would suggest it's probably better when you've got a bit more severe pain and not necessarily use it when you've got mild pain. But once again, it depends on what your needs are, may be when you want to use your TENS machine. You can also use a TENS machine if you expect that you are going to suffer from pain if you've been sitting at a desk for some time, to actually be ready should you need to turn it on at short notice. So heat and cold has a lot of places to play in pain management. In general, there are rules around when you should use heat, and there are rules when you should use cold. So heat is very good for a stiff, painful joint, but if the joint is hot and swollen and stiff, then perhaps a cold pack may be more benefit. We use cold packs regularly on things such as sprains and strains, and we know that helps. And we also know that heat helps when we've got perhaps a painful shoulder or a back or a knee from time to time. So putting it together a toolkit that has certain things to help with managing pain using heat and cold is probably worthwhile considering. So cold therapy, I'm not suggesting you put your bag of frozen peas in the box, but knowing where you've got a bag of frozen peas, perhaps in the freezer, that is only used as a cool pack. They don't have to be expensive peas. They could be the very cheap, family-friendly peas. But the good thing about a pea bag of peas is really it does mould to a joint quite well. You can also buy things over the counter at numerous shops, such as instant cold packs. You've also got deep freeze sprays and gels. If when you're having severe pain, you experience a lot of headaches, then maybe using a cool gel sheet for the forehead will help. You'll also see in the picture a gel pack or a freezing pack of ice cubes. Once again, these are quite good. You can keep them in the fridge. They mold to joints quite well. The one there demonstrated is a wine bottle cooler that you can buy at a reasonable price that you can then put in the fridge or in the freezer so it cools around the joint. It's important to remember though, when you are using cold, you need to make sure that you do not directly apply it to the skin because this can cause an ice burn. Ideally, put something like a cloth between it, maybe a wet cloth, and even using something like a baby oil or cooking oil on the skin will help prevent a burn from the ice. You can use it for about 15 to 20 minutes. You need to check the skin to make sure it isn't starting to get the ice burn. The area will feel cold and maybe feel numb, but it shouldn't feel too uncomfortable. As I said, always make sure that the skin hasn't changed to a bluish tinge. That means that the circulatory has been closed down to that site area. And you can apply an ice pack every 2 to 3 hours if needed. Using heat and warmth is very good as well. So as I said, if you've got a painful, stiff joint, which isn't hot as such, using something like a heat pad. Of course, with ankylosing spondylitis, you've experienced pain in the back. So there now are things on the market, such as a back heated pad. You can buy small heated packs electronically. Of course, we've got the good old hot water bottle. And those of you who've not seen it before, there are now these about a metre long hot water bottles with a cover that you may find useful, especially when laying in the bed against your back. There are TENS machines out there that also have a heat function. We know the good old heat bags or the wheat bags. Remember when you are using a wheat bag to check the instructions. Do not over microwave it because as with food, the beans continue to increase in their intensity and heat once removed from the microwave. And then there are all things, once again, such as the topical heat sprays and gels that you can buy over the counter at most places. And more we're seeing today these new clothing that have thermal heat packs in them. They're designed mostly for people who are working outside, but you can now buy them reasonably from places like Amazon or online, especially for if you've got back pain, you may find them useful. There are also some devices that are specifically designed for knees, shoulders, hands that you also may use. And then in the middle, if you've got painful feet, because you've been at work all day, you may want to put it in nice, cool, soothing water, but you also may find that putting them in these electronic foot pads useful. So when you're looking at managing pain as well, you can alternate between using heat and cold. So if you've had a period of time where you've been using the cold and the joint has settled down, once again, you can reapply heat, and alternating may offer you, once again, additional benefits. There are some cautions to be aware of. Be aware if you have circulatory problems, you've got heart conditions, you've already got broken skin or thin skin in certain areas of the body, you may not want to apply heat and ice. If you've got reduced sensation and you're a diabetic, once again, be cautious of using these because you may not be aware that you're either over cooling or overheating area. If you're using patch treatment drug therapy, such as pain relief patches, HRT patches, smoking, sensation patches, once again, don't use heat or ice above those areas because they may affect the absorption of the treatments through the patches. Be aware if you've got, as I said, diabetes or other conditions such as epilepsy. And if you're unsure of what to do, then always do seek opinion from perhaps a health professional or a physiotherapist. So other things that you could put in your pack that may be a bit more of interest are things such as a distraction therapy. So distraction is the body's ability to overcome the sensations from pain by being preoccupied doing something else, or the brain thinking and concentrating on other things. So it's moving your attention away from the pain so that the pain is no longer the source of discomfort. There are lots of people who are very good at being able to do this just by playing a game of cards, using counting, deep breathing exercises. And once again, you can buy things that you can put in your toolkit that may be available should you need them. There's also a very good web page, and sorry, I haven't put that on there, but I will, when I send the slides to NAS, add the web page on. But there is a web page that you can access that takes you through the different types of distraction therapies that may be useful, giving you some tips. There's also a very good sheet which you can complete on about how you experience of perhaps using deep breathing exercises, how useful you felt it. So should you need to refer back to what you found useful in the past, you can then quickly look and find out if there are things in the past that you found useful or things that you found not so useful. So in your toolkit, you may want to put a good film that you enjoy, you find quite humorous, that lightens your spirit. You may want to think about colouring books and crayons. You may even want to go back to it using Airfix models, board games, cards, dominoes, craft items. Even getting out in the garden and looking at how you garden, if you're a keen gardener, may help. Also cooking, people find cooking enjoyable. And then also you've got things like the DVDs, Hawaiian beach sounds, which helps to relax the brain or relax the mind, allowing relaxation to be better experienced. Aromatherapy has a place to play. Once again, I would suggest that anyone who wants to consider aromatherapy, they seek the opinion of an experienced aromatherapist or a shop that has staff that can guide you through the appropriate aromatherapy. So there are many ways you can use aromatherapy. There are things such as roll-ons, such as a lavender roll-on that you may want to use to help relax. You can use it in massage. You do have to be aware that if you are using in a massage oil, that you do not over make the concentrate too high, because this can cause problems. So always follow the guidance on the pack. You may want to add it to a bath, and once again, only add the right amount of drops per bath when you're using them. You can use them to a cold or warm compress, and definitely the lavender bags or the heat bean bags are quite good to put a few drops on to help relax. And then you can also use them in room diffusers. And there are certain oils that are available that help you in numerous ways. There are some that can stimulate you. There are some that can be quite good for relaxation and muscle pain and tension. As said, aromatherapies are potent, so only use them in the loop as recommended. Be aware if you find irritation on your skin, be cautious, perhaps try a small area before trying perhaps a back massage. Always use a carrier oil that is, absorbs the oils effectively, such as coconut oil or the proper oils you can buy with the aromatherapy sets. But do seek opinion once again, especially during pregnancy, as some of the top oils may not be thought to be useful or appropriate during pregnancy. The other good thing about aromatherapy, there's lots of things of association. I use lavender. I like lavender. It does help me after a busy day at work, and that brings back good memories of my grandma, who always smelled of lavender. She loved her lavender perfume. There are other things, associations are, you may, if you have perhaps a citrus smell, it may remind you of a lovely holiday in Italy or France or Spain. Going back to even baby talcum powder, for some mums, they find that quite reassuring and relaxing, brings back memories of when their children were younger. And then there are other ones such as Christmas smells that once again gives you an association of a happy time, which helps distract the brain from the pain sensation. Music and audio type programs are really good. So there are numerous ones that you can buy on DVDs, but also nowadays you can buy a number of relaxation videos and DVDs through the internet. It may be there are certain musics that bring back good times, such if you're born in the 1970s. Some people found windpipes, wind chimes and the old panpipe music very good, classical music, or even something like a show where you went out to a family, playing that music may distract you from pain. There are also visual distractions. The device on the left of the screen is which you can use on either your iPhone even, whereby it helps you to do deep breathing relaxation exercises. And what the device does, or some of the iPhones do, projects a beam of light onto the ceiling, and then you breathe in and out as that beam increases in size or diminishes in size. I'm not too sure if anyone's used it yet. There are some studies going on looking at these iPod and iPhone devices whereby you can project images. It may be you have a video of a family event, or maybe just some reminiscent or even virtual worlds. And there are some big pieces of research going on about how virtual worlds may help people, especially children, manage their pain with chronic pain, or even preoperatively and postoperatively. If you're into stars, or you like to distract your mind, even projecting perhaps the stars or the atmosphere onto your ceiling may be of good use for you if you like that sort of thing to help you sleep. Singing therapy is a distraction therapy. There are lots of groups. Unfortunately, I expect most of them have stopped at the moment because of the caution around COVID-19. But actually, when we get back to normality, singing therapy groups are very good. Family karaoke's maybe something that you want to try, or even just singing to yourself or the dog or the cat may be useful. It's key also perhaps in your toolkit to look at improving your posture. We're very much into iPads, iPhones, which does change, or laptops, which changes our posture. And that posture may cause more problems later on in the day, especially if it's very intense. If you were to look at yourself using perhaps an iPad, you would find that your wrists, elbows, shoulders, and even your position of your neck is fixed, which can exacerbate pain. And there's a phenomenon now called texting neck, which is about poor posture as we're texting more and more these days. If you're working from home, make sure you have perhaps even a laminated sheet around exercises you should be doing at home while you're working on the PC, or even when you're in the office, trying to get a bit of exercise at the desk will be important. Posture at home, if you look at your posture, you may find things that you need, such as positioning couch pillows. The maternity pillows, which is this U-shaped long sausage type pillow, is very good if you find it difficult to get into a good posture in bed. And as I said, important when you're looking at the television, reading, you look at your posture to make sure you've got good posture, preventing stress on the spine, shoulders, neck, and other joints. And of course, you can see these things that you can buy, the pillows for the bed, which may help you if you're reading in bed or doing activities such as watching TV. These are difficult and you do need to practice these, but are things you should be considering. As I said, Tai Chi relaxation exercises are very good. Relaxation music we've talked about. Guided visualization is something that takes you a little while. You do need to perhaps practice this before you're in pain. And once again, there are numerous good web pages out there that supports people to take them through guided visualization. There's also progressive muscle relaxation exercises and deep breathing exercises And all these can add to and enhance the medication that you're taking. I remember talking to two of our patients, and what they found was getting together when they were having a bad period of pain and putting on a good old film to have a laugh, or even sometimes even a good film to have a cry at, releasing their tension and being able to explore their feelings with each other in bad times. Hopefully, at some point you could have a full presentation on getting a good night's sleep, because sleep hygiene and maintaining a good pattern of sleep will help take the edge off significant pain. And we know that poor sleep exacerbates pain. So it may be things like winding down before you go to bed, having a warm bath, look at the amount of caffeine you drink during the course of the day and towards the end of the day. Looking at alcohol, lots of people believe that alcohol is very good because it helps to induce sleep. But the issue with alcohol is that it does allow the tongue during relaxation to fall back against the back of the throat, which increases snoring, which contributes to poor quality of sleep. Look at taking your painkillers appropriately prior to going to sleep. Avoid overeating because it can make you uncomfortable and disturbed, but also watching television or using an iPad in bed is probably not a good way of winding down at the end of the day. Look at the bedroom. Is it cool? Is it dark? Is it quiet? Look at keeping to a set routine. Looking at how much you nap during the course of the day, and if you do nap, perhaps nap earlier in the day rather than later in the day. Not to do excessive exercise before bedtime, but maybe doing the stretches, the Tai Chi, Pilates may be useful. And if you're hungry, then perhaps having a small snack rather than a large meal. Also, hopefully your physiotherapist will be giving you an exercise plan, and I know NAS has some very good videos on exercise and information. So within your toolkit, your exercise and activity records is important. Make sure you're exercising regularly, you're doing different forms of exercise to maintain good muscle strength, posture, and help relieve pain. Remember, any exercise you do, if you concentrate a period of exercise over an 8-week period and you continue to exercise, you will continue to improve. If you reduce your exercise, you may find that actually over a period of time, you've lost that benefit. And if you stop exercising, the likelihood is within a quick time frame, you will lose all the benefit from the exercise you've had around posture, muscle strength. There are a number of challenges in pain management. It's very difficult. As patients, you have very limited amount of time with a healthcare professional. There may be healthcare professionals that perhaps don't understand your pain or have little time to explore pain with you. Lots of us are worried about exploring new options. And this is no theory behind this. I always categorize my patients into 5 groups. Patient 1 are following my talk or a presentation. They may go away and do nothing. Realistically, they'll be coming back to my clinic or having conversations with me in 3 or 4 months that the pain hasn't changed. As with weight management for myself, the second group of patients where they start well and then they lose motivation. Most things do need you to persevere over a period of time, trying different things to see if you can get different outcomes and benefits from different forms of exercise or things in the toolkit. There's also the patient in group 3, and once again, this is very difficult. So we have a good intention, we start, we do well, we lose motivation, and then we restart again. And once again, that's very difficult. You need to be consistent when you're trying new things to improve the quality of your pain. The next group is a difficult group. These are the patients or the members of the public that are looking for what's the next thing on the market. So they are constantly searching, looking for new things. They often haven't taken self-management as an important aspect of their care. They often want a quick fix, and therefore they're relying on information about new things that may be good. The best patient and the best patient group of patients are those who take on that the pain is their responsibility to do something about it, and they maintain different ways of looking at managing their pain, engaging with healthcare professionals, and even looking and being inventive and exploring different options. Of course, all of that is influenced by our personalities. Some people are half cup full, half cup empty. Our health beliefs, once again, do we believe that the pain is a healthcare professional's responsibility to manage, or do I as a patient have a responsibility? What support networks we have out there? Do we have family and friends that are out there championing different things, happy to explore things with you? And it has to be at the right time. If you're in acute pain and you try something today, you may find it doesn't work and you give up quite quickly. Whereby practicing or using some of the things early on and seeing your experience of them may be that when you do have severe pain or pain that's increasing, you've found something that may be able to help take the edge off the pain. So what are your options from today? Option A really is that you're going to look at something and perhaps consider it. Think about building your own toolkit so you have got something in the background should you need it, or no action. But I would suggest that you will be back here again, perhaps in 4 or 5 months, asking the same questions about what can you do to manage your pain differently. Thank you very much. Any questions?
Hi, Colin. Thank you. That was fantastic. Really interesting. I will just come off the sharing. Perfect. So hopefully everyone can see us both now. We've had a few questions coming in already. So if anybody watching has any more questions for Colin, then please do pop them in and we'll go through them all. That was really comprehensive. So it was really great to have a look at all the different things that can impact pain and all the different tools people can add to their toolkit. So thank you. Our first question coming in, so Heather firstly commented to say thank you. It was really helpful to look at alternatives to medication or things to work alongside. She did specifically ask as well about essential oils and the electric diffusers and whether they're safe or not. I think that was Samantha. Sorry, Samantha had asked about that. Have you come across any information on that?
I know a few years ago when we were using the diffusers with candles, there was a lot of concern that people would put an essential oil in a diffuser candle and then they would fall asleep. And then as the water evaporated, then the oil would catch light. So I'm cautious about the candle diffusers. Some of the electronic ones, I've personally bought one. You can have time set, so you can set them to run for half an hour. But of course, when they dry out, there's no flame as such to catch fire. So most of the safety is around flames and fire with the candle diffusers. I would urge probably people not to do, because the other thing is you don't realise how hot they can get. You may want to leave them and drop them, which causes a fire risk.
Oh, that's helpful and reassuring. Thank you. Heather's question was around using essential oils in the bath with Epsom salts. Have you come across Epsom salts being helpful for joint pain?
I have. We've seen a bit more of people talking about Epsom salts recently. I haven't had much experience myself, and I haven't read up much on it. But of course, once again, if there's people are exploring it, I'm not saying it's a thing that someone shouldn't try to see if it helps them. But I haven't got no clinical evidence or research evidence to back my statement up to date. But it's something if people believe they want to try, and as long as there's no contraindication, then I would suggest it's something that people may want to think about.
Absolutely, thank you. And we also have a question about Ian regarding pain medication. So he said that he was understanding that pain is easier to control if you're taking the painkillers regularly, and that if the pain then increases, it's harder to get under control. Do you have any advice around that?
I would always suggest anyone who's got pain, you take your painkillers on a regular basis. As you start to diminish, or you start to notice the pain has started to improve over maybe a few days, then perhaps to start to withdraw them, see how you get on. If you looked at paracetamol and you may say, actually, I woke up this morning, I'm in quite a lot of pain, I'm going to take my 2 paracetamol. At lunchtime, you may think, actually, I'm not in too much pain. You may want to just take 1 paracetamol. And then perhaps a couple of hours later, you think, oh, the pain's come back. You can still, as long as you don't take more than 8 paracetamol in a day, you can follow the guidance and change your medication. I would always have that conversation with a healthcare professional or even a pharmacist about advice, but it's about getting the pain under control, perhaps adding in other things to see if you can take that additional edge off. And then when you start to see pain control, start to withdraw the painkiller, because you want the painkillers when you need it. And I think we, as a community and healthcare professionals in rheumatology, are very worried about the number of patients who escalate through pain medication, maybe start from paracetamol and escalate right the way through to pain patches or even morphine-based medications. But actually, once you've got to that level, then where do you go next? You're stuck, really. Once you've used, when you're on the maximum doses of painkillers, you are kind of stuck and you've got nowhere to go. So trying to do things early on, getting into use to practice using a TENS machine, using heat and cold, using relaxation therapy, Tai Chi, Pilates, all may help you not having to escalate your treatment to small, higher levels of painkillers.
That's really helpful, and yeah, I completely agree. If you can combine things to help reduce the medication, it leaves you more options than if you do have to increase it. And certainly I'd echo that pharmacists, I think, are a wealth of knowledge, so they're always worth speaking to get specific advice on medication. And so our next question comes from Samantha. Samantha asks if you've had any experience about diet and pain management, whether diet can influence pain at all. It's
once
like
again,
a curveball.
No, that's something I haven't once again looked into. I know there's lots of excitement about anti-inflammatory diets and things like that. I'm not a dietitian by background, therefore I've probably got the right experience to advise that. I don't think any healthcare professional has got or concerned people want to try it, but be aware that some of them exclusion, if they're excluding diet, if they're exclusion diets, you may find you're not getting the right minerals and vitamins that you need in your diet. So maybe asking for a dietitian review, perhaps just trying it. As I said, I don't think we're particularly concerned if people want to try it, but the evidence is very difficult. We're also unique in our body metabolism and things like that. I think it's very difficult for me to say, but a dietitian may be able to help. And there's lots of information on the webpage. And some of the other charities, so you've got a number of charities that look into pain management. So they may have some information useful on their web pages that people
Absolutely.
want to sign up for.
Okay, fantastic. Thank you. I've seen George was asking about any advice on relieving pain in the sacroiliac joint. But what I'll probably do is I'll reply to your comment, George, with a link to, we've done a previous video on low back and SI joint pain. So we've got some stuff specifically for that. Unless you just add anything.
Very hard to get. I mean, heat may help, but it takes a little, it's quite deep. So therefore it's not something you can just apply and think, oh, I'll be all right in 10 minutes. You may have to apply a bit longer. Just for it to seep into the tissue and into that area. So it is a difficult one. I do appreciate there are certain parts of the body which is more difficult to manage pain than others.
Absolutely. I think, yeah, SI joints for being deeper, and also ribs are quite difficult sometimes because it's an area that's always moving. So yeah, we've got some specific advice for those.
Like rib pain, there's some good information on the NHS webpage around rib pain. I'll send you the link to that, because there's some things that you can do perhaps to help if you've got rib pain.
Oh, that'd be great. Thank you. I'll add it to our resources and pop it in the video description as well. Okay, great. Oh, we've got a great comment from Elaine saying she's going to watch this again because she's realised that she's in a different place with her pain level now. So she's to try again with managing her own pain. So thank you. I think that's really helpful as well, is just that time to kind of reassess, because when you live with pain day to day, you're not necessarily aware of it building up over time. So yes, hopefully lots of people watching today will be able to take that time just to reassess and see if there's anything else they can add in.
It's amazing. I've got all the kit. When I do the presentation face to face, I have got a box of kit, and it's amazing. Someone will say, I've got shoulder pain today, so the hot water bottle comes out, or I've got a bit of back pain, the TENS machine comes out. So most of our kit that we use for the demos has been used by most of my staff at some point when they get to work and they've got a bit of pain. But that proves that actually having some stuff or around when you need it is important. And once again, if you are at work, you may want to have another kit you keep at work or in your office lockers or drawers the way if you need it, then you've got it there, rather than think I've got to sit here in another 3 or 4 hours of pain before I go home.
Absolutely, and it's so easy to forget what does work as well. You know, I've been known to be messaging a friend saying that I'm in pain, and they'll just say, "Oh, have you taken your anti-inflammatory?" I'm like, "Oh, of course." And you know, I could have gone, you know, a day or two forgetting to take something that, you know, is quite easy to help relieve it. So yeah, if you've got it all there in one place where you can go to when you need it, yeah,
I was
it's a
talking
really
to a
good
patient
reminder.
this week, and once again, her and her husband, once again, they're online. There's some simple massage techniques that you can watch videos on. So she's got pain in her hands and her elbows, and so her and her husband have been watching these videos, and he's been doing a nice aromatherapy hand and elbow massage for her, which she's found really helpful. But she said before she'd been to one of our pain management talks, she'd never thought about training her husband to be part of her pain management toolkit.
Absolutely, that's a genius idea. I wonder if any bribery is involved. um, Great. Well, just seeing we've got another comment coming in from Lucinda, who asks about she finds it difficult sometimes to realise that pain may be an issue before it gets too severe. Do you have any tips on that? I suppose other than regular check-ins, really.
Yeah, I think it is about having that time, especially it depends on our lifestyles. You can, young mums or anyone can be very busy, and suddenly you've had to get everything under control. You had to get the children to work, school, when we were at school, and suddenly it's at lunchtime, and you've not realised the pain over that course period. So checking in regularly with yourself and just thinking, how do I feel now? Do I need to do something different? Do I need to ask for assistance? And even looking at a pain diary is quite good, because once again, a pain diary allows you to explore what the pain is, what may have exacerbated the pain, and what you may want to do about changing it. And there's there's a very good there's numerous pain diaries on the internet that are available to people to just to work through it and see what they've tried, what they've found useful, how their pain changes. We all know if you've had a busy day today, you'll pay for it tomorrow probably. So actually thinking about what today means, what you can do differently today may have an impact on what you feel and how you experience your pain tomorrow.
Absolutely. I think that's really important to think of, because sometimes it's only in hindsight that you think, oh, I should have done something else. So yeah, it's really good just having those little reminders just to check in with yourself.
And I think definitely we've seen more people saying, with lockdown, sitting at we're not necessarily sitting at our usual desks, we've not got our usual furniture, we're using dining room tables and that. They were never designed as home offices, dining room tables. We've used them, and you can find you're sat there for 5-6 hours, not moved much, you're not getting up perhaps as you would in a normal office, and therefore you're getting stuck, you're in a rigid position, a tense position often. Definitely using iPads and sitting on the sofas. The best thing I always say to patients is to get someone to video you using an iPad and watch what joints move. And realistically, once you're in a fixed position, the only thing that really moves is your thumbs and your fingers and your eyes. The rest of you can tense up quite quickly.
Absolutely, yeah. And yeah, again, it's something that I think is only afterwards, when you sort of unfold, that you really realise how much you have tensed up.
Yeah.
Oh, we've had a lovely comment coming in from Pete, who's had AS for 30 years, and he's just now ordering that metre-long hot water bottle. He's not known about these before, so thank you for that.
It's fantastic.
Yep, and just to reassure everyone now joining, we'll keep the video on this page afterwards and pop it on My AS My Life. And Colin, I think you said, are we able to share the slides afterwards as well?
Yeah.
That's fantastic, thank you. Yeah, we'll pop those on our website as well. Great, so I'll just have a quick look, see if there are any more questions. Did you have anything else to add in, Colin? I know you've given us loads of info already.
It's key building the other one is, once again, getting that right support network with family and friends, perhaps, to understand when you're having a bad day what you need. And also, as I said, just think about what you can put in a box, and when you need it, it's there ready for pain.
Perfect. And actually in our shop we have little wristbands that people can wear that are color coded red, orange and green for if you're having a bad day, a okay day or a good day. So that's quite good if you want something easy for friends and family to see how you're feeling that day. That can be really useful.
I think that's one of the things that's really hard when someone keeps a bit like when you're unwell with a cold or something like that. So people constantly say, "How are you? How are you?" It can be quite draining just to have that same conversation. And when you're living with something like AS for a number of years, that can drain you even more. If this is very visible, but make sure you do tell someone. The wristbands of a different colour have no place if you don't tell someone what it really means, so they know what they can do.
Absolutely.
I think if the partners also struggle because they know that their partners are in pain, and they feel often at loss of what to do. But actually, as I said, things may be, would you like me to try and do a massage of your wrist? Even just simple hand massage helps to relax people and things like that. So it may be that just this gives a conversation about how a partner can also be involved in trying to support someone who's got pain.
Absolutely. And later this year, we're planning on having a session all about talking with friends and family about your condition, how it affects you. So I think that's something we can build into the conversation, is discussing with people how they can help as well. Okay, perfect. Well, thank you, Colin. I think that we've got to the end of all the questions so far. So if anybody has any more questions, if you can keep adding them, and we'll come back and answer them. I'll send any tricky ones over to Colin as well for his expertise. But thank you very much again for the session. It was really helpful, and thank you everyone for joining and getting involved.
Yeah, take care, keep safe. Hopefully we'll be in a different position soon.
Absolutely.
Okay.
Take care, everyone.